Time for our nursing tip of the week, and in this week's tip, we are going to be talking about ET tube. An ET tube, also known as an endotracheal tube, is a tube that can be advanced down a patient's airway and connected to a ventilator to assist in oxygenating and ventilating a patient. I thought I could cover some of the parts of an ET tube as well as give you little tidbits here and there. So let's just dive right in. The ET tube is made up of this kind of flexible plastic tubing, and then there'll be a little cuff or balloon on the end that is deflated prior to insertion. This cuff is what actually kind of sits back in the patient's airway and is inflated to hold that balloon in place. The cuff is inflated with the pilot balloon. So one good way to know if your cuff is blown, there's a couple ways, but one of them is this pilot balloon here should feel kind of squishy when it's inflated, and if the cuff is deflated, this pilot balloon will also be deflated. There's a bevel on the end of the ET tube, and then this Murphy's eye right here is so that way if the bevel end gets completely occluded off, hopefully that is not occluded off as well. So ideally, the patient's airway won't get occluded. However, mucus is mucus and it can plug all the holes. But it is like an extra safety measure. There should be some sort of measurement on the tube. So right here, this is an 8.0, so 8.0 millimeters. It's the internal diameter of the tube. The bigger the number, the wider the tube is. Typically in your average adult patients, we're using ET tubes that are at least a 7 up to about an 8, but occasionally you'll see a higher number than that or a lower number than that. All of these little markings right here indicate the centimeter depth markings of how deep that ET tube is. So when an ET tube is initially placed, we will look at the centimeter markings to see where it's at on the teeth, to the gums, to the lips. Lips can kind of swell, so a lot of times lips aren't used, but we will see, okay, we're 25 centimeters at the teeth. And that's a good way to compare where the placement is from, each assessment, each shift, to make sure that the tube hasn't further advanced back or been pulled out. This little level of vocal cords line is for the provider that's placing the ET tube to help them gauge how far they need to advance it. There's an actual picture of an ET tube, so you'll see the same things. There's the cuff, it's deflated. That pilot balloon connects to that cuff to help inflate it. There's a one-way valve, so the air won't leak out once it is inflated unless you have a hole somewhere in there. We have the centimeter markings. This radio opaque line helps pick up on x-ray where the ET tube is placed to ensure that there's the correct placement. Here's another picture of an ET tube that's advanced down a patient's airway, so you can see that the cuff is inflated in the patient's trachea right there, and then it goes out the patient's mouth. This is very short. Normally the tube hangs out quite a bit more. Okay, that is a super fast run through on ET tubes. Let me know if you have any questions.